Yeah, hello. I'm Gerdet. I'll be taking you through the barcode feature. Then after we just demo the barcode itself. But first I have to welcome everyone and thank you for joining. So just to give a hint where we're coming from. So we did a study, an innovative two-way texting approach designed to enhance client retention in HIV care while addressing the workload challenges faced by the HIV clinics, mostly here in Malawi. So it started as a research study. So for the success of this project, we did a collaboration with a couple of key partners. So we had the Department of HIV, Kamboja Central Hospital, and the Lilongwe District Health Office. Since it was part of a study, we had to obtain research approvals. So we got one from the University of Washington in Seattle and National Health Sciences Research Community here in Malawi, because it was a part of a research. So for this project to come up, we've been facing some challenges in terms of client tracing. Uh, we we are determined that tracing is a resource intensive, which requires really a significant human and financial investment. Just to give you a picture, this research happened here at MPC, which is Martin Prus, which is under Lighthouse Trust. Lighthouse Trust is one of the HIV service providers. It has the largest cohort here in Malawi, about 65,000 recipients of care. It has five major clinics, one in the northern part of Malawi, two in the central part, and another two in the southern part. In the central part, we have two where this research was happening. So we have Martin Prus and Lighthouse clinics. In total, they have about 35,000 recipients of care. Monthly, on estimation, we have about 7,800 um, clinic visits monthly. Of that, 10% miss their appointment. That means the team has to do the tracing for about 780. As you can see the numbers, it's really human and the financial investment that is required to do all the tracing. Then when we go into the numbers, we find out that much of the tracing that we have, there are some tracing that we initiate that are just maybe mislabeled, missed visits, or the client just silently transferred to another clinic without alerting us. So trying to put all the resources to trace this client, uh, it's a toll. There have been some innovations that we did. There was a frontline SMS that was done in 2020, 2011 and 2012, and a standard SMS for my mobile. So what was the possible solution? The proposed solution was, let's involve the hybrid approach, combining the automated and the manual texting to engage clients proactively before they missed their appointment. So that's where the two-way texting came in. So just to compare the standard of care and the two WT. So what happens in the standard of care? So Clients receive support from peer buddies. While in 2WT, we blast some motivational messages on diverse healthy topics. With the advantages, we automatically remind clients their appointments without involving anyone, just two-way texting system doing everything. In the standard of care, there are reminders that happen through phone calls. Uh, by the 2WT, we send SMSs a day before, 3 days before. Even if they miss, we also send a couple of automated messages. So this we thought is much too advantageous for 2WT because with internet or phone number, with the network or phone numbers being off, messages can be reached at any time and is automated. So it means there is no one who is intensively being involved behind the scene trying to send these messages. So when we're implementing the 2WT, one thing that we noticed was when registering clients, there was a couple of errors that we are getting. So just to give you a picture, for Lighthouse, we use the EMRs. So when a client is being registered, there is a barcode that is generated and the client is also assigned the patient ID. So these patient IDs are alphanumeric. That means they have the letters and the numeric, the numbers. The challenge that we had was with um, transcribing these numbers. So you find there is an I, maybe it might be mistaken to L, and zero be mistaken to O and some stuff. Since we use data from the EMRs, for integration to really work, we need the patient IDs to be as correct as possible. So we requested our key partner, the Medic Mobile, who developed it, to incorporate the barcode scanner in the 2WT system so that we shouldn't have that challenge to try to write down the patient ID because it was very, very vital. So the barcode scanner was incorporated in the registration process, and it has been helpful in terms of integration because our system 2WT has to integrate with the EMRs to get the latest visit dates that have been um, captured in the EMR. So the barcode scanning app that we're currently using is called Binary Eye. Why did we choose Binary Eye? This is really very compatible with a wide range of Android devices, including the newer and older versions of uh, of the the Android. So when you try to install, just to take you through installation, it's straightforward for everyone. We go into the Google app and search the binary I, then we tap the installation, then that's it, we go. So it's much easier to install everything. It's much easier to do installation. Of course, I've shared the URL that you can just click and it will take you direct to the binary I for installation. So this has been integrated into the 2WT so that it can ease our challenges that we had. So when we've logged in our app, and we're trying to register a client. Of course, we'll demo this, how we do the registration, but these are some of the forms that we use. It's a continuation. So when we have a client in front of us, we get the first name, the surname, then the launch app. Here is where we click and it takes us to the binary eye for barcode scanning. Once it takes us to for binary for scanning, the patient ID will automatically be reflected on the national ID field. We fill in the filing number because at some point we might need to trace the file of a client. Since it was part of the study, of course, we've moved it to a program. We need also the consent. So the client has to consent to be getting messages as a system. We request for a phone number because this is a two-way texting where they can reply, and we have to make sure that we've gotten the right phone number from the client. So we do have to get the phone number. Since it was part of a study, we had a time where doing randomization, so we had a group that were getting messages, another group were not. So in our case here, we just clicking the texting. So on the texting under randomization, it means the client will automatically be getting messages. Um, we also do capture the client's preference language. So which language are you comfortable with getting the messages? So we've chosen two because these are well understood in our country. So we have two. So they either choose English or Chichewa, but they can respond in any language that they might prefer. But our messages, when we are automatically blasting them, we send them in the language that they chose. So this is how I can say in terms of how we use the barcode in our setting. So Maggie is going to take us through a quick demo. Then after um, we can open for questions.
Good afternoon. I'll be taking you through the demo on how we enroll our clients. As my colleague mentioned, that we're using the CHT for enrollments. On the CHT, we have got 4 tabs, as you can see from my screen. And then from the 4 tabs, we select the People tab. And then when you select the People tab, it will direct you to the facility from where you are enrolling the client from. In this case, it's the Martin Plus Center Clinic. And then you open. After you open, it will bring 2 forms, whereby the other form is the form where we enroll without the use of the barcode, and the other one we use barcode. So in this case, we select the one which directs us to the use of the barcode. And then here, I'll just demonstrate quickly how we fill up the form. We start with filling the form. So in this case, let's say the name is Emily, the first name, and then surname is Wilson. And then this is where we launch the barcode, as he has already mentioned, that we are using the binary eye for scanning on the Android phones. So here we launch the app, and then when we launch the app, it directs us to the scanning of the barcode. And as you can see, the box was empty, and now it has captured the patient ID. The barcode really makes things easy, as it saves time, and also saves you from committing unnecessary errors, as he already mentioned about mistaking I's for ones and mistaking fives for S's and the like. Then from there, you fill in the filing number. Our filing numbers usually have 5 digits, and then here we'll just complete the form as the client has already consented. Then here we fill in the client phone number, starting with the country code, which is plus 265 here in Malawi. 9. And then our phone numbers here comprises of 13 digits. And then here on the alternative number, we just leave it blank unless the person has an alternative number, which in this case is the alternative number is only used as a backup when the main number that they have provided stops working. And then since it was a study, we still have this component, but we opt for the texting one since we want our client to be receiving messages. Then we'll ask for their language preference. In this case, let's put English. For the Telegram ID, we will ignore because it was only used for study purposes. Then next, it will bring us the form for verification for us to check if we have made any mistakes. Then thereafter, we submit. And then after submitting, we synchronize so that the client may receive a confirmation message that they have been registered into the 2WT system. Other than that, I will stop from there and then we may take questions if there are any questions. Thank you.
All right. Thank you, Maggie. Does anyone have any question to Gilded or Maggie regarding the demo and then two-way texting application or implementation? Please feel free to unmute yourself and ask a question.
Hello, Neeraj. Can you hear me?
Yes, we can hear you, Sanjay.
Hi, Maggie. Just wanted to know about the QR code utilization. Is that the QR being used only for this study purpose, or is being used for all of the use cases in Malawi? So that would add the extra context because we have also working out with the functional ID as the health ID to be used with the multiple digital health specific solutions. So I think that will add us the extra information for us as well. So thank you.
Maggie, Gilded, do you want to answer that? Yeah, I see Gilded unmuted.
Yeah, so currently, we've started, we registering clients on this platform for two sites. That's Lighthouse Clinic and Martin Plus Center. These are the two sites that we're currently rolling out the service.
I wanted just to extend to, I don't know if I got the question correctly, but the patient ID is used across Malawi, and the 2WT was developed as one of the intervention to reduce loss to follow-up and the workload of healthcare workers. So as Gated has mentioned, we started with the two facilities. So we are using the existing patient IDs. So we had to configure our system to accept those existing patient ID through scanning. Then to two facilities and we're offering it as a routine service, but plans are to scale it up to other facilities within Malawi. And we have had discussions with the Ministry of Health. They have shown interest in the system. Thank you.
Thank you, Maggie. Thank you.
Great. Does anyone have any additional questions? Please feel free to ask. You can unmute yourself.
Yes, hello. Yes, mine is it's just a comment, additional comment on the system, the app that is being used. Right now it's binary I because I think it's the latest one that has been updated previously for downer versions of Android. Trove, we're using another app, Android app. Sorry, so yeah, an Android app, but with other recent versions of Android, we decided to use binary I, which is compatible with the latest versions of Android. So for all the folks who will be using this, I think it's one of the third-party apps that they can look out for. And I think there is work ongoing in the community to eliminate third-party systems in the Enketo forms. So at least this can be done natively within the Enketo forms. So yeah, I think it's just pending testing. Thank you.
Thank you, Cliff. Anyone else has any question? While we wait for the question, I have a question. So is this, if somebody wants to just to follow up on this one, so is the app implementation or is there any documentation available for people to look into it after the call?
Yes, there is a documentation for the app. I think we can share that on the chat.
Thank you, Hanno. That would be great, I think. Does anyone have any additional question before we move to the total cost ownership? Please feel free to unmute yourself and ask. You can also put in the chat and then we can come back to the questions later as well.